We always hear about the microbiome in our gut, but few people know about the biome that exists in our sinuses, our oral cavity, and our tonsils. Instead of antibiotics, there's options. Here's a discussion with my friend and colleague, Daniel Benning, who had a profound experience with a fungal infection.
Well, Daniel, thanks again for joining us. And boy, I don't know about you, but one of the things that I really learn is with stories. Stories help me remember things, helps me remember details. And boy, you've got a great story about adult ENT, and I just wanted to have you on to just share what that story was and what happened.
Yeah. Joe, it's interesting industry. Sometimes we learn so much by our own experiences here. And what I'm showing right now is my personal MRI of my sinuses. And I put in there's a fungus among us. And if you see circled in red, those are the maxillary sinuses. And they're supposed to be actually black or clear. Okay. And as you see on the left picture, the left side is fully impacted. And then the top down view on the right side, you'll see that left side is fully impacted. And a dear mentor of mine several months ago was talking to me about adult ENT, a sublingual probiotic for ear, nose, and throat treatment. And this challenge I was having was just sitting there. I couldn't breathe well. Nothing was moving. And he said, well, why don't you try adult ENT? And as we go through the slides, you'll see the effectiveness of this product. But what it finally did for me is it finally got stuff moving that we could send it off to a lab and get it cultured. And what we found here is valley fever hanging out in the sinuses. And there's an old study of the 90s done by Mayo Clinic on the incidence of valley fever stuck in the sinuses, causing actually respiratory issues, feeding that pathway. So I became a huge fan of adult ENT, and it's helped me get much, much better. And I wanted to share some of the components of the adult ENT, and then we also have the children's ENT, as you see in this slide. So ENT stands for ear, nose, and throat. The beauty of this product, and I know, Joe, we've talked about dosing before, but you're only taking 1 or 2 lozenges a day for therapy. You have strong adhesion to the mucosal lining. It's boosting your immune response. Have you had that kind of feedback, Joe, with 1 or 2 capsules a day?
I have. I tend to go a little bit higher sometimes, at least at the beginning. But I think the beauty of the product is it tastes so good. I mean, I give it to my grandkids, and they're like, can I have another one? Can I have another one? And
right.
So that's, to me, that's the beauty is. And there's so many infections, and kids go to school, they come back, and they got the snotty noses and stuff, and boy, it seems to clear it up pretty fast. It's not like a miracle worker, of course, but what would normally progress into something bigger just seems to go away in a day or so. So that's without the fevers and all the other stuff. So I'm a huge fan.
Yeah, you have some impressive strains in here. Lactobacillus delbrueckii and rhamnosus, and as the combination blends, there's over 40 clinical studies, and we were found to demonstrate high levels of antagonistic activity towards the microbes that are most frequently found in chronic and recurring ENT infections. So this is a well-studied product. In my next slide, I show that the bacteria promotes health through driving mucosal immune mechanisms. Statistically reliable increase of the number of tonsillar cells producing IgA by 30%. That's an impressive immune boost.
That's huge. Just to remind our listeners, IgA is really the immune response for the mucosal linings. And that's not only for the sinuses, but it's for the lung, it's for the bowel. And so if you can increase your IgA by 30%, you're increasing your overall immune system for sure.
Yeah. And so this product also has lysosomes in it, which is an enzyme used to lyse bacterial cells by hydrolyzing, getting a little technical here, hydrolyzing the peptidoglycan in the cell walls. which exhibit selective antibacterial properties. So beyond just the probiotic component that is locus to the ear, nose, and throat area, we have these lysosomes as well.
And one other thing, just as long as we're talking about this, I'm kind of a big fan of natural killer cells. And when I see NK cells, maybe it's because of the NK cells, but those, anytime I see something that increases natural killer cells, I always pay attention. And this is, again, one of those products that it's a probiotic, but it stimulates your body's own natural killer cells, which is, again, that's the beauty of it to me. Go ahead.
Right. And what I found in the literature, in what we saw is, which gets a lot of people's attention and got my attention for sure, is the anti-candida activity of this product. Candida albicans, 90% effectiveness against that. Candida krusei, 80%. Candida tropicalis, 100%. Again, remember what I mentioned earlier on is what Mayo Clinic found is these fungal infections hanging out in these sinus pockets, feeding respiratory issues. And now you have a product that can actually get in there and help reduce this fungal bacterial activity in the ear, nose, and throat areas.
I heard the presenter put this together. One of the things that she said is you could give this product while someone's on chemotherapy. You could give it to them while they're on antibiotics. And so it's a very easy product to use. It tastes good. It's a patient-friendly product. That has a lot of applications. And the other thing is, it also helps open up the bowels. I mean, I've talked to a lot of doctors that when they've got somebody stuck, they'll give them adult ENT or children's ENT, and they'll kind of dose it pretty high for a couple of days, and boom, it really opens up the bowels. And I'm not sure exactly why that is, but when you take a probiotic that we think about it as just an oral probiotic or for the sinuses, it adheres to the mucous membranes, but it's having an effect in the lower GI too.
Yeah, well, we've always talked about north to south.
North. Yes, we do. Well, Daniel, thank you very much. It's always so fun to talk with you. Thanks for joining.
Appreciate you, Joe. Thank you.
Adult ENT Pro or Children's ENT Pro provide probiotic organisms that kill Candida and many other pathogens that create ear, nose, and throat problems. Your patients will love the berry flavor and many will see profound results. Thanks for watching. I look forward to being with you again next Tuesday.